Hey Swanky Medics, today we are going to talk about the femoral triangle. So there will be a few words regarding the borders that make up the femoral triangle as well as the contents. So let's start with the borders. The lateral border of the femoral triangle is made by the medial border of the sartorius muscle. On the medial aspect, you find the medial border of the adductor longus muscle. And superiorly, you find the inguinal ligament. The base of the femoral triangle is made by three muscles. So on the medial aspect, you find the pectineus, followed by the tendon of the psoas muscle, and laterally you find the iliacus muscle. The roof of the femoral triangle is made by the skin and subcutaneous tissue. So those are the borders that make up the femoral triangle. So now I'm going to talk a little bit about the contents. So what you're seeing here are just the main contents of the femoral triangle, and there are a few more that you can find within the triangle, which I will describe to you. So starting from the lateral aspect, you find the femoral nerve, which is one of the nerves that comes from the lumbar plexus. Okay, that's followed by the common femoral artery. Now the common femoral artery can divide into the deep femoral artery and the superficial femoral artery. This can be seen within the femoral triangle, but sometimes this division can occur outside the femoral triangle, and the usual rule that they have is that the division happens about 5 centimeters below the femoral triangle. But like I said, it can also occur within the femoral triangle. So we know that when it comes to anatomy, each body is different. So there are discrepancies that can occur from body to body. So that's something to keep in mind. The common femoral vein is the most medial structure, which then follows the division of the femoral artery. And what you can see here, this is the saphenous vein. The saphenous vein is connecting to the femoral vein by using a structure called the saphenous opening. Okay, the saphenous vein comes from the medial aspect of the foot, so it's draining blood from that aspect and it brings it all the way up to the common femoral vein through the saphenous opening. Now, like I said, these are the most common structures that you can find within the femoral triangle, but there are a few more. For example, like the lateral cutaneous nerve of the thigh, which is also a branch of the lumbar plexus. You can see here the obturator foramen. So usually you can also find the obturator artery, the obturator vein, the obturator nerve. And also you can find some lymph nodes. You can find the deep inguinal lymph nodes. Okay, so those are the structures that you can find within the femoral triangle. Now there are a few more things that I want to talk about, for example the femoral sheath, but I'm going to use a different diagram just to make it easy for you guys to understand. And this is the diagram that I'll be using. So what you're seeing here, highlighted in orange, are the muscles that make the base of the femoral triangle. This is the iliacus muscle, followed by the tendon of the psoas muscle, and this is the pectineus muscle. Okay, what you're seeing here, the femoral artery, femoral vein. This is the femoral canal, and we will talk a little bit more about that. The femoral nerve, and this is the other nerve that I mentioned, the lateral cutaneous nerve of the thigh, which is a branch of the lumbar plexus. Now, these structures are surrounded by something called the femoral sheath, and you can see that the femoral nerve is not part of that femoral sheath. The femoral sheath is made by fascia, and it's made superiorly by the transversalis fascia, which is basically the continuation of the transversalis muscle, and inferiorly you find the fascia iliaca. Okay, so the fascia of the iliacus muscle. Now let's concentrate a little bit on the femoral canal. When it comes to the femoral canal, you need to know the borders, the contents the surrounding structures of the femoral canal. So superiorly, you have the inguinal ligament. Medially, the lacuna ligament. Underneath, inferiorly, you have the pectineal fascia or ligament, the pectineal ligament. And laterally, you find the femoral vein. Okay, so those are the surrounding structures. Now, the femoral canal has inside something called the Clockett's gland, also known as the lymph node of the femoral canal. Okay, but why do we need a femoral canal? What is the functionality of the femoral canal? One is to allow the distension of the femoral vein. So sometimes the femoral vein needs to expand, and that it uses the femoral canal as an extra area in order to distend and to expand. And the other one is to basically allow a communication, because it contains a lymph node. It allows a communication between the lower limb to the external iliac nodes. So there will be lymph going from the lower limb through the lymph node of the femoral canal or Clockett's gland to then reach the external iliac nodes. So those are a few more words that I wanted to include about the femoral sheath and the femoral canal. So this gives you an overview of the femoral triangle. So we talked about borders, we talked about the contents, and we talked about the functionality of the femoral canal and the femoral sheath as well. So if you have any questions that you would like to ask regarding the femoral triangle, leave a comment in the section down below, and I'll try to answer to your queries as soon as possible.